In today's Health Smart, we are looking at a staggering new trend. Plastic surgeons are reporting an uptick in patients under 30. And joining us now with what every potential patient should know is board-certified plastic and reconstructive surgeon, Dr. Rady Rahban.
Good to see you.
Good to see you guys.
Yeah, so we actually talked about a study or report that came out last week about millennials just getting so much surgery, and it has a lot to do with our phones, right, and social media.
It has everything to do with social media. I think the reality is that people under the age of 30 are constantly being barraged with images. And these images, you know, we used to look at magazines and TV once in a while, but now when you're on your phone constantly, your sense of self and the image of what you think you should look like is changing and evolving. And because of photomorphing, I mean, a lot of the images aren't even real. And so there's this desire to look different than you do.
So what are the common mistakes a lot of these patients are making?
Well, the first is to fall into be tricked by the images. I mean, the one thing you need to know, I mean, I have a lot of patients of mine that come from social media that are so-called influencers, and they really don't look like their images. So that's the first thing you need to know. So what you're striving for isn't actually in actuality. And the second is that while these images might be in some way useful, the reality is you still need to take traditional steps in terms of educating yourself and not be so influenced by influencers.
Okay, so aside from millennials, a lot of people do get surgeries, men and women. If you're deciding to do that, how do you research the right doctor? Because, again, websites can even be fake.
True. So the first thing you need to know is there's no overarching watchdog. I mean, you're really in this by yourself. If you do your homework, as you would if you were buying a car or buying a home, I think you can really navigate it quite well. Having said that, first thing you need to know is you need to know the distinctions of these practitioners. You know, once upon a time you wanted to have surgery, you'd go see your plastic surgeon. No longer the case. Now we have cosmetic surgeon, facial plastics, oculoplastics, dermatoplastics. So there's all these different individuals. So you got to know who you're going to, what their training is. And while reviews and websites are important, you got to take everything with a grain of salt. And at the end of the day, you got to use your gut. So I would suggest you should never go in, see someone and be like, this is my guy. You should really see a few people and get some, second and third opinions.
So what are the top surgeries right now for men and women?
I'd say for women, still at the top of the list is going to be breast enhancement or breast augmentation, rhinoplasty, and of course, moms are having mommy makeovers, which is just kind of a catch-all term for maybe a breast lift and a tummy tuck. Men still on the list is going to be noses and chins, and of course, as one ages, you get into the facial aesthetics like facelifts and things of that nature. So it's pretty much the same tried and true procedures, just with a new twist on it and new names, which can be misleading.
And who should not get surgery?
A lot of people should not get surgery.
Oh, okay.
So first of all, people who can't financially afford it. You know, we live in a country where we leverage everything. So people are in debt for all kinds of things. It certainly shouldn't be plastic surgery. People who have no home or background or people supporting them. You don't want to be on an island by yourself. People who are not medically or health-wise. There's some people that come in and they want to have procedures done. This is elective. You rupture your gallbladder, you need to go get it done no matter what. You want a facelift, but you have diabetes, you had a recent heart attack, you're probably not the best candidate. And so I think those are really the main categories of things you want to avoid when kind of getting plastic surgery.
All right, I know one of your favorites is the mommy makeover. It's a big deal.
It is.
Yeah. It's good stuff. Okay, so for more information on Dr. Rady Rahban, you can visit his website. Lots of information there. It's radyrahban.com. You can also find him on Instagram at Dr. Rady Rahban. Thank you. I follow you on Instagram.
I follow you.
Good stuff.
And look at that smooth face.
I know, right?
All right.
He's a smooth operator.
All right.